Okay, this is Real with Robo Part 2. And like I said, I was reading a little bit from Dr. Lee G. Thomas, MD. Granted, she's an OBGYN, so, I wanted to point that out before this thing is, but I think it's more important that I go ahead and read to you the actual data that has came from this. So to repeat what I was leaving off with in the last Real with Robo, medicalnet.news, Dr. Lee G. Thomas, being China reported falsely on crucial time period, meaning the crucial time period when it all started, China lied, basically. It didn't help with the response times or the reaction time or the preparation of the world pandemic. And it also altered the future, meaning when we could have found out much earlier what the cause of all this was, how to deal with it, etc., because China lied. Now, medical experts say China's reporting falls outside of medical recognized and accepted norms. As you can see, I have the actual article brought up. And it's not by somebody like, myopiniononcovid.com. Okay, YouTube, so don't try and censor this. It's from a medical expert. And I'll give you the references at the end, because there's a lot of them. Now, this study came from let me see where it came from. The researchers at Washington University and St. Louis School of Medicine and Ohio State University. Okay? So that's where this basic research came from. The outbreak estimated begun October 2019, even though they said it was December 19 in Wuhan. But even with the December 2019 begin date, 27 cases of pneumonia of unknown origin, which was reported by the Wuhan City Health Commission, other official figures, and one media report showed that over 45,100 cases and 266 cases, respectively. Okay, so the Wuhan City Health Commission said there was only 27 cases. But other official figures showed 45,100, and one media report said 266. Official Chinese state media said many COVID deaths were unreported due to being treated by private establishments. So it's just basically, the private establishments that were under the CCR, basically the Communist Chinese Party, or Chinese Communist Party, they didn't report them. So it was like underreported. But the researchers, like I said, from Washington University and St. Louis School of Medicine and Ohio State University, they gathered data from COVID-19 figures reported by Chinese government statistics, report by official and non-official media, and that includes investigative media reports on cremation numbers in Wuhan. So this video is going to be about the cremations that happen in Wuhan versus the official reports. coming out of China. Now, as I said before, China has said that there has only been 4,742 deaths from COVID in China, in the whole of China. So let's see what these researchers say. The current study of the infection, estimated as of February 7th, 2020, fell between 305,000 to 1,272,000 deaths, while death estimates are projected to be between 6,811 and 7,223 for deaths. So the infection rates are like 3,000 times higher than what China's reporting, and the deaths in just that little period are 10 times the official figure, which is about 13,600 and 545 respectively for Wuhan. Okay? So it's like out of, it's just mathematically impossible. Now the reports. There's 8 crematoriums in Wuhan who normally worked 4 hours a day and mostly in the mornings because of the Chinese, religious rites. So their custom dictates, only in the mornings, and the deaths were like only using up 4 hours a day in the crematoriums. The change happened on January 25th, 2020, when those same crematoriums were working around the clock, or approximately 6 times the normal levels. The normal daily 136 deaths per day for the 9 million population. The study, it shows that there was actually about 680 deaths per day, and a total of approximately, with those hours, 816 deaths per day, mathematically and scientifically and medically. The max cremation, though, is 2,100 bodies per day. So we're looking between those numbers. So it still doesn't sit with, there was only like 454 deaths a day during this pandemic in Wuhan. Additional cremation staff were brought out to Wuhan and 40 mobile cremation stations. So that means there was 48. But if the deaths were so low, why would they need all that? Logically, it's impossible. February 19th, 2020, to accommodate the death and cremation needs. So, as of February 19th, 2020, they had 48 crematoriums, basically, and more staff to help out there, running around the clock. You see what I'm getting at, and you see what they're getting at. Now, the simple linear equation, at 80% utilization, January 25th through February 6th, 2020, and then at 100% until February 12th, 2020, the deaths would be above 9,300, with crude case fatality rate officially reported at 3.14%, the infection rate. It would be almost 300,000 in 19 days. So we look back at how they said there was only like 454 deaths. And now we see that even mathematically, it'll be over 300,000 deaths with their fake reporting. Now, the funeral urn distribution up to March 23rd, 2020, estimated deaths at 36,000, which is 10 times the official figure of 2,524. So if you're looking at 36,000, and then you refer to the first list by Statista, China said that only 4,742 people died in China, in the whole of China. And here, even with their crude reporting and their lying, 300,000 deaths, over 300,000 deaths happened in 19 days in Wuhan. And up till March 23rd, 2020, 36,000. So that's what? About 9-10 times what they reported for the whole country just happening in one province. Cumulative infection potentially to be over 700,000 people, not including mobile cremation stations, which would be likely to be grossly underreported because of the CCR. Okay, now I wanted to read you this directly from the article because it has a lot of numbers. The exponential growth model. The researchers then used a model showing an exponential growth rate from January 23rd, 2020, when the lockdown began, to the beginning of the observed effects about 15 days later. This is a valid approach provided the assumption made that lockdown effects will begin to show only after February 7th, 2020 is correct. Beginning with a doubling rate of 6.4 days, a figure of 680 deaths per day on February 7th, 2020, at a varying crude case fatality rates of 2.5%, 5%, and 10%, they estimate a cumulative infection in Wuhan of 1.27 million, 650,900, and then 305,000 respectively. The number of deaths would be about 7,000 in all cases. The start dates for the outbreak would be, in such a case, October 4th, 2019 to October 11th, 2019, and October 17, 2019, respectively. If the doubling time is 2.54 days, the start date would be December 14, 2019, but the projected total number of infections would be over 2.2 million by February 7, 2020. So, by those numbers, it shows when they started reporting on December 14th, but they grossly underreported it. Either the news of the outbreak was significantly delayed and underreported in the first scenario, or the official case numbers were reduced by millions in the second case. I'm going with the second one. That's just the way China works, in my opinion. Finally, if China's data on the 39% ratio of infections in Wuhan and China are used, the number of Chinese infections would reach over 5.6 million by February 7th, 2020. Now, serious implications. The Chinese media pointed out their strain on Wuhan's medical resources in January, February 2020. Even though the city was reported to have about 90,000 beds by the end of 2018, plus an additional 100,000 beds allotted in hotels and schools by the beginning of February. This ratio of 190,000 available beds to about 33,000 confirmed cases has not been explained. And what also has not been explained to me is how these accidental makeshift hospitals just collapsed and killed everybody in there. Neither has the fact that despite the more than 90,000 doctors and other healthcare professionals in Wuhan at the start, another 42,600 were sent in from other provinces, with almost 170,000 ventilators imported to Wuhan to look after only 50,000 officially reported cases as on March 23, 2020. Earlier researchers have also pointed out mathematically impossible COVID-19 figures from China's establishment, estimated that over 85% of infections were not reported, and that by February 2020, the number of confirmed cases in China would have been well over 230,000 and not 55,000 as officially reported. The study's conclusions are limited by the fact that it did not include other cases of excessive death during the lockdown, such as those occurring due to the difficulty in assessing medical treatment of other diseases at this time, the financial stress, and the lack of support for emotional and social needs. Nonetheless, the researchers conclude that official reports of COVID-19 cases and deaths from China are lopsided, with a huge discrepancy between the cremation-based estimates prepared in the current study and the Chinese official figures available in early February. The significance of this is grave, since the period from February to the end of March was a critical one with respect in preparing for an adequate response to the worldwide spread of the pandemic. The investigators comment that this suggests the need to reevaluate China's official statistics and consider all available and reasonable data sources for a better understanding of COVID-19 pandemic. The study concludes the magnitude of the discrepancy between the results from their analysis and China's official figures suggests that the potential impact on the global efforts to control the pandemic is obvious. Transparency in China is of critical importance for the world to learn from this infection and from those in the future. Now, the important notice is MedRxiv publishers preliminary scientific reports that are not peer-reviewed and therefore should not be regarded as conclusive, guide clinical practice health-related behavior, or treated as established information. In other words, this is another medical science-based paper. Now, there's a lot of references here, and most of them come from Chinese Center for Disease Control and Prevention, lots of Chinese stuff here, www.gov.cn, from Yi Chao, Epidemics in New York Worse Than Wuhan, and he's a blogger. GMO6, Where Do the Bodies Come From That Cannot Be Cremated, Even with All the Crematory Staff and Burners Running 24 Hours a Day, February 10th, 2020, gnews.org. People complaining about them being first in line. www.chinatimes.com. I'm just reading through some of them. The Wuhan City Administration. Marked increase during one night, 242 deaths in Hubei. And funeral staff from all over China hurried to go to support. News.migage.com. Most of these I can't read because I don't read Chinese. Practical exploration of medical waste disposal in Wuhan. Vehicle-style shelter is about to go to Vulcan Mountain. www.zenhunet.com. Interim clinical guidance for management of patients with confirmed coronavirus disease, COVID-19. www.cdc.gov. I know that one. You know that one. That's ours in America. Muniz, Rodriguez, K, Chow, G, Chuang, CH, Giodi, Lai, PY, Li, Y, et al., doubling time for the COVID-19 epidemic by province, China, emergency infection distribution, 2020 August, cited on May 25th, 2020, dx.doi.org. China reported a huge increase in new COVID-19 cases. Here's why it's actually a step in the right direction. Time.com. Again, www.gov.cn. www.nhc.gov.cn. Diary of Pneumonia. April 17th, the revised crew death rate in Wuhan rose to 7.6%. That's mchina.caixin.com. ChinaDigitalTimes.net. Some more Chinese doctors. Newsweek, March 29th, 2020. We know that one. And Cohen J. Wuhan Seafood Market may not be the source of the novel virus spreading globally. And that's www.sciencemag.org. Journal reference HEML 2020 cremation-based estimates suggest significant under and delayed reported of COVID-19 epidemic data in Wuhan in China. Okay? So there's a lot to take in there. But basically, when people want to blame America and England and Trump and the CDC and the DHS and Dr. Fauci and all them, we want to also be reminded that if they had the proper numbers and the proper research data then from China, then maybe we would have had a better response time, a better response to the epidemic that turned into a pandemic, that turned into a global pandemic. And this, even though it's not political, it does prove that China lied and continuously lies. The videos that I made 1 and 2 about the COVID-19. And that the best thing was when Trump did shut down travel to and from China and brought home Americans from China and sent home Chinese from America that were visiting and made sure that everybody was tested. Now, granted, there's more that I want to do to prove that Trump is not all to blame for the pandemic and global pandemic, but I'm currently researching the fact that if we had the proper numbers, the proper data, and the proper beginning, we would have had a proper response. Of course, I am sad for all the people that died. But if you want to give credit to the pandemic, let's give credit where credit is due. Number one, to China, because they lied about the pandemic. And there's also a thing floating around that the NHI funded the research at the lab where it broke out in Wuhan. And that involves, I'm not going to say conspiracy theory or a fact, because if they indeed started funding at a certain point in time, the conspiracy theory turns into a valid, questionable thing that may need to be researched. But the conspiracy theory is that we produced it here in America, and the CDC and the DHS shut down the NHI from researching it. Dr. Fauci, who was in charge, sent it over to the Wuhan lab because they didn't have such strict research rules and laws. And then the NHI funded it to get the research from them researching it. But that is for another video. My point, in fact, here is that the deaths, number one, are congruent with other large populations that handled it like we did, i.e. England, i.e. the other countries. And if it wasn't for the lies by China, we would not be at such a downfall at this point. We would have been ahead of the game. Also, if the last administration would have prepared the proper ventilators and proper attire, then possibly we would have been able to get it sooner. And I'm not blaming the last administration, because how did they know? Oh yeah, that's right. Because they said it was okay for Dr. Fauci to do that, because the government funds the NHI, and the NHI has to ask for permission to fund their conquests from the administration. Oops. But don't take my word for it. You guys go research that for yourself, because right now I'm currently digging into that. As per the numerous deaths, we must also give credit where credit is due to Cuomo and de Blasio and Michigan and the other 5 states that, oh, and don't mind that in the back, my bunny rabbit is just going nuts. But other states that sent home COVID positive patients to nursing homes. So we need to give them credit as well. We need to give Biden credit for being out till May, when we quote unquote knew about this back in February, and he was holding rallies and speeches where no one was wearing a mask. So let's give credit where credit is due. Let's also give credit to Trump, okay, for doing the same exact damn thing. Let's give credit to all those cities that allowed all those riots, where masks were worn improperly or not worn. Let's also give credit to Pelosi, who was running around Chinatown saying, oh, you know, this, that, and the other thing, we're having a great time, come on down, you know, don't be afraid, and all that. Let's give credit to the full, entire governing body of each of our states and each of our cities and our country. Okay? And let's also remind each other vehemently that Trump was the one that shut down travel to all these infected countries and travel from all these infected countries. And they usually go through New York or LA, where the biggest numbers have been.